Cameron, and welcome to the first Lyme Hangout. This hangout was inspired by my book, Lyme Disease Ticks on Medicine, where I'd like to not only just write, but I'd like to have an opportunity to discuss with readers topics that came up in the book. And later I'll go on to other topics from blogs that I'm writing in the future or other topics in general. So tonight, I want you to take a look at your screen and you'll see a comment section on the area below the live session where you can write comments. I'm going to be addressing what comments I can get to after my presentation. You will also see on the right-hand side of the screen one of the chapters from the book, which addresses the 12-year-old who had a cardiac arrest related to Lyme disease. Now, the Lyme Hangout with the live streaming is a wonderful opportunity for me to spend some time with you. You know, I take time with patients all the time, but this is a great opportunity. So I'm going to be switching over to a PowerPoint presentation, which allows me to summarize what I learned from these three cases. Now, all three of these cases were first published by leading medical scientists based on careful observations of cases they've seen. Each of them were published in a PubMed journal. I read the article, reviewed the article, and included in the blog and the book to be able to give some insight from actual children with heart disease that are out in the area. That doesn't mean all children have troubles, but it's still important to champion troubles like this to make sure we can get to know these cases, understand the cases, and be able to look out for unusual presentations of Lyme disease. The first case was a 12-year-old boy who suffered a cardiac arrest due to Lyme disease. We'll follow with a 15-year-old girl with carditis and a 17-year-old boy who died suddenly from cardiac arrest. The 12-year-old boy had been participating in an outdoor camp for 2 to 3 weeks. He started gasping for air while riding as a passenger in a car. He developed cyanosis, which meant he didn't seem to be getting the air that he needed. He had a cardiac arrest. That afternoon, he had been in a recreational outdoor activities with others. The family recognized the heart problems. There was fulminant myocarditis. That meant that the heart was inflamed. Fulminant means extreme. Most of the issues were all electrical, not like blockage of arteries like you see in traditional heart disease, not like the heart block, which is the atrium, which is the top of the heart. You know, most of the time you have first and secondary heart block. This one involved more of the center of the heart. They actually called it a junctional ectopic tachycardia. Tachycardia means the heart rate's over 100, and it's in the center of the heart and the fascicles of the heart, causing a fast heart rate, eventually ventricular fibrillation, cardiac arrest. The blood test showed a positive ELISA for Lyme disease and also a positive IgG and IgM Western blot test for Lyme disease. So when you have a cardiac arrest, it's most important to focus on what you do to save the child. So that's why you see a whole series of defibrillation, intubation, intravenous epinephrine, lidocaine, dopamine, norepinephrine, protocaine, and amiodarone, all used in cardiac arrest no matter what age. But in recognition that the electrical issues were related to Lyme disease, the boy was started on ceftriaxone, which is an intravenous antibiotic, for 3 weeks. There was a full recovery of his heart functioning, but the neurologic injury was important that led to long-term rehabilitation. Brain imaging showed that he had some brain edema called cerebral edema and hypoxic injuries to a number of areas of his brain. He altered mental status, agitation, dysautonomia. Now, those problems, mental status changes, concentration problems, agitation, and dysautonomia do occur quite commonly in Lyme, but this appeared more likely related to the heart problems and then eventually brain damage. The second case was a 15-year-old girl, an African-American girl, who was hospitalized with a 3-day history of retrosternal pain, which is behind the breastbone. Epigastric is where the stomach is. It was twisting and gnawing. The pain was a 9 on the 1 to 10 scale to show how severe it was. No evidence of costochondritis, which is the pain that you get when you press on your rib cage. This was described by Fish from Johns Hopkins Hospital in Baltimore, Maryland. There was no evidence of gallbladder disease, which was the original problem. Gallbladder disease is often something you might see in a 40-year-old woman. In this case, the evaluation led to a broad range of abnormalities in the heart, mostly electrical again. Low voltages, that's that complexes that go up and down in the heart. QRS complexes are the widening of some of the pulses and the electrical activity. The electrical axis, which is the way the current's going through the heart. Some conduction problems between the ventricles, which is the lower part of the heart. The blood test called troponin was elevated. The ventricle systolic shortening was occurring. A little bit of fluid around the heart called pericardial effusion. The Lyme test was positive by ELISA and immunoglobulins. The girl was treated with furosemide and enalapril, which are controlling fluids and heart function. Doxycycline was prescribed, and fortunately, despite all the cardiac problems that this girl had, she was in the hospital. They recognized that it wasn't a gallbladder issue. They treated the child with doxycycline, and the child was discharged from the hospital at day 7. The author advised that in patients with Lyme disease who complain of cardiopulmonary symptoms, clinicians should have a low threshold. That is, they should be prepared to obtain at least an EKG to evaluate for Lyme carditis. And that is because each EKG picks up electrical issues. Now, that doesn't mean everybody with these symptoms has carditis. In fact, so many kids and adults have palpitations, which is where the heart sensation is there. They'll have some chest discomfort, a whole wide range of symptoms that don't have heart problems. In fact, cardiologists often don't look as much as they thought they should because so often children are normal. But these 2 cases really show how important it is to at least be evaluating the heart. I often send people to cardiologists if I have to try to explain cardiac symptoms. The third case that was in the literature was a boy who was at a 2-week stay at a camp in Rhode Island. Came in with a cough, occasional fevers, a sore throat, malaise, headaches, body aches, not what you might think of as serious according to the description. Symptoms progressed. He complained of gastrointestinal problems. He was lightheaded. He had light sensitivity. This is by Yoon from New York Medical College. Now, the boy had negative Lyme tests for Lyme, negative Lyme tests for anaplasmosis. They were thinking Powassan, according to some of the notes, which is a virus that's in a tick. He was instructed to rest and stay hydrated. A few days later, the boy collapsed suddenly in his backyard. He had gone into cardiac arrest and was taken to a hospital in Westchester. He died several hours later. On autopsy, they found Borrelia spirochetes, which are what causes Lyme disease, in the liver, heart, lung, and brain tissues by both a PCR and an ICH testing or staining. The ELISA and Western blot at this point was positive by IgM, and the Powassan virus was negative. So the The three cases are all important. They may not be common, but the 12-year-old boy who had a cardiac arrest due to Lyme disease, the girl with carditis, and the 17-year-old boy who died of cardiac arrest shows the severity that can happen with Lyme disease. So what I'd like to do is spend a minute and discuss what does this mean in my practice. Well, even though a lot of children have Lyme and do well with Lyme, it's extremely important to always be thinking about children as we approach the spring. How can we prevent tick bites? How can we prevent missing a case? I like to take symptoms rather seriously at all times, but particularly when a child comes away from camp, away from the active outdoors, it doesn't always turn out to be a problem right at the time that they're outdoors. It might be a few weeks later. Also, children can have a broad range of other issues that aren't heart later on in the fall or winter. So this is just a reminder with these three case reports of one unusual but very important manifestation. So I'd like to do is now change the program to look at comments that have been coming in on the site. I have an iPad here that I like to look at and look at some of the questions that have been coming up. And so I'll address what I can here. And then if I don't catch all of them, I'll come back later and maybe on my Instagram, which is Dr. Daniel Cameron, or my Facebook, Daniel Cameron MD, I can address some of the questions I might miss or might come after the end of this session. You should also be aware that if you miss any part of this presentation, I'm going to be archiving this presentation, and it'll be available on the website in the future. So if some cardiac issue comes up, it'll be easy to reflect on these three cases and what we're discussing tonight. So if I start my discussion here, one of the questions is, my cardiologist does not believe in Lyme, yet his pulse goes from 48 to 170 and had a positive tilt table. I've been a doxycycline for 6 months. Is this enough? I do see a doctor who's familiar with Lyme disease. One of the other manifestations that's extremely common in children is autonomic issues, where their blood pressure is unstable, their pulse is unstable. When they move, they might be lightheaded, they might be dizzy, might be lightheaded. And so during that evaluation, I typically involve a cardiologist to make sure that there's no involvement of the heart. But the heart seems to be okay most of the time. It's just that some of the cardiologists have a tilt table, some neurologists have a tilt table. They put you on the table, move you in such a way to see if you have an over-responsive tachycardia to that event. And that can really be disabling. Some kids can't even get to school or have a hard time standing up. It seems to be related somewhat to the adrenaline system. It's one of the more difficult treatments to take on. Because this child was treated with doxycycline for up to 6 months, is that sometimes if that isn't working, there's also other pills that are available, like amoxicillin, there's Zithromax. Sometimes people have babesia, which is a parasite in a tick. And so as I look at the opportunity and options of treating with a different antibiotic, I also make sure that cardiologists are involved, sometimes neurologists, to make sure there's nothing else involved. And to make this question more complicated is that some people have some other neurologic things like pandas and pans that are kind of different manifestations that we'll get to in some future presentation. But follow up, and hopefully that child will do well with persistence, even if they have to change the medicine. The second question is that I'm listening and interested. Thank you much for your interest. My son contracted Lyme disease when he was in 7th grade, unbeknownst to us. He became so anemic, he was at risk for cardiac arrest and was ambulanced from our local hospital to a bigger hospital. So this reminds us that even if Lyme is common, is that it's very important to look at the whole person, the whole child, and make sure there's nothing else happening. So anemia can certainly give troubles. It can make you have cardiac symptoms. It's hard, in these kind of questions to know the whole story. Comprehensive workup's important by several specialists, but including somebody familiar with tick-borne illness is certainly helpful. The next question is, is a high resting pulse rate anything to worry about at any age? I'm talking 107, 109. Well, this gets back into the autonomic nervous system. Also, I find that Lyme disease is a stress state, or at least it feels like a stress state. And so I'm always concerned about the resting heart rate being somewhat elevated. It also creates a fair amount of anxiety. The Lyme hits the various neurotransmitters that affect anxiety, agitation, irritability. But any pulse rate that's high might be deconditioning, but it's also important to include a cardiologist in there to find out if there's anything wrong with the heart rate. There's a question, is there a link for the hangout? I can't see anything. Is that that's a technical problem that hopefully that we can get to, because this will be followed up with an archive section if for some reason you can't connect. But I see that someone already answered no. Go to danielcameronmd.com, look for a Lang Hangout. So looks like somebody's already figured out how to get to it. And so if I look at the other questions, is that there is a question of electrical issues, is that versus traditional cardiac problems. And I can tell you that in these 3 cases, we're not dealing with plugging of the arteries or atherosclerotic disease of the arteries. They were discussing more of the electrical current. The CDC recognized rather early that there is some conduction problem. So they called it heart block, whether it's 1st degree, 2nd, or 3rd. What this case review shows is that there's other electrical parts of the heart that are affected. So the heart disease, the carditis that they're describing is more of an electrical issue as opposed to a hardening of the artery, plugging of the artery, or a loss of heart tissue like you might see. So it affords an opportunity to come up with some treatment. Let me refresh the screen on my iPad to see if there's any other questions that came in. How do you treat Lyme carditis? Showed up when I refreshed my screen. Lyme carditis hasn't really been studied in any formal way. So what I've seen is that you treat the same way as you would for Lyme disease. So you saw that one girl who had the case, they treated with doxycycline because it wasn't as acute, even with all the electrical problems. And the doxycycline seemed to take care of the rhythm problems, and she went home. Whereas the child who had the cardiac arrest, when it's an emergency and you're in the hospital, they tend to use intravenous. Plus, if the child's unconscious, intravenous makes sense. Very important when you recognize one heart manifestation or one problem with Lyme is to be aware that there's more than one thing in a tick. So if you get a positive test for one organism, or if you find Lyme carditis, just be aware that there's other bacteria in the same tick. So you want to make sure you stay with that child until they get better. And if they stay sick, I always add other specialists to make sure that as a team, everybody's working on their particular perspective, and we have to get that child better. Let me refresh the screen again, because the reason that we may not have as many questions is that this is the first Lyme Hangout. I didn't anticipate the focus on this topic and interest in this topic and overwhelming response I'm getting to the first Hangout. And so in the future, we should be able to have a few extra questions ahead of time if someone sends them in ahead of time. So feel free next time to send them in. This is a story or question of, I am in Australia and they are in complete denial about Lyme disease. I have a daughter who has been supposedly diagnosed with Lyme, yet I can't get a definitive diagnosis, and therefore treatment here is even more challenging. So the moderator said, welcome Australia. I agree. There's always a question on in every area of the world of, are there ticks and are there infected ticks and what's in the ticks themselves? And so we often find that the researchers are applying certain strains. They're looking for certain strains, certain types of ticks using one strain. And it takes a while for each region to identify what's there. So Canada, they didn't think there was really ticks there or infected ticks. And they found out that birds are carrying those infected ticks. There's up to 200 million deer ticks that make it to Canada every spring. There are also ticks that are flying in birds south in the U.S. There's problems with Lyme and other tick-borne illnesses all across the world. And so it seems as if it's hard to have any part of the world that doesn't have some exposure to, and just when we have a rule that they aren't in Australia or aren't in the southeast United States, or they're not in Canada, the next study comes along and say, oh, never mind that fact. Is there are problems there after all? It's just that medicine tends to challenge everybody that presents these cases. So whatever's happening in Australia is that there's always that inertia from looking again at what ticks are there, what's in a tick, and those type of things. So I encourage those people in Australia who are sick to get those scientists, those entomologists out there to try to understand what's out there. Because if there is something from a tick, we want to know, and we want to have the scientists there. The other thing you should be aware of is that people travel. Kids travel, adults travel, and you have to really get to know what's going on and not trust that kid's going to stay just in that backyard. They could get these infections someplace else. So be aware. Another thing that when we deal with scientists is that there's always a lot of fun facts. The fact last week that I ran into was they were looking at all the diverse ticks in North America, from Canada all through the United States, and they decided the only way you can get that many ticks out there and that diversity of ticks and severity of ticks if the ticks were around since at least the last ice age. And this was a study out of a leading institution. And that means that they felt that the ticks are around for the last 20,000 years at the least. They had to move out of the way when the glaciers came through. They went to the south. Then when the glaciers melted, they went the other way. So just be aware of times are changing. Let me see if there's any more questions that came in. They recently found Lyme disease in Nepal. So there you go. So a reader was saying is that there's more observations all the time of where these ticks are, even Babesias, all across the entire northern hemisphere. And so there was a study recently that they thought Babesia, the parasite in the tick, was only on the coast. I've been seeing it all along in the northeast and the Hudson Valley. So they finally said, well, somehow those ticks got Babesia and they're spread all through the Northeast, and maybe as many as 40% of those ticks, when you get infected, will lead to Babesia. Now, there's a protocol. What herbal protocol do you suggest if Lyme carditis is present? The herbal approach is not really studied so much, and so but because Lyme can get rather complicated, there's a broad range of treatment modalities that are suggested. I'm not familiar with the nuances of which herbal treatments are out there for Lyme carditis. Oh, someone had sent me something through an email or through and it doesn't showing up on my screen, but it said Lewy body dementia caused violent and visual problems. I think they had found maybe there was Bartonella, maybe there was parasitic worms. The challenge is that if you go ahead and look at dementia or problems like that, Parkinson's, is that there's not near enough research out there to understand what's going on. And so even though I was a dementia specialist 30 years ago, was very involved in it, there's still so much that's understood. They sometimes find things on testing, and just there's always inertia in medicine. Like, we're always trying to be cautious on what's going on with dementia, but we sort of need to find out what's going on. Oh, this particular question also had to do with he was diagnosed with AFib. Well, AFib is extremely common, but 1 out of 4 Americans have AFib. And so they really haven't looked at whether that AFib is an electrical issue also. And with such a high prevalence, 1 out of 4 having AFib in a lifetime, is that you don't really particularly know whether any of that's related to Lyme or not. It hasn't really been studied enough to know. Let me see if there's anything more on here. Would you consider heart pounding a symptom? Blood pressure and pulse are good. The heartbeat seems to be louder. That is actually more common to have all kinds of chest symptoms, palpitations, irregular chest pain, troubles in the chest that need an evaluation anyway, no matter who has it. So it's but it's much more common to have symptoms that actually have something wrong with the heart itself. But given the severity of heart problems, it's still important to take these symptoms and presentations seriously. Can vertigo and balance issues be symptoms of Lyme? Well, vertigo, which is a dizziness, which is often inner ear problems, is quite different in Lyme patients. They typically don't have the overwhelming dizziness where they're in bed throwing up, can't move at all, the kind of vertigo that might last 3 or 4 days. They don't have that severity typically. Now, most of the time what we see is movement related. They get up too quick, move too quick, stand in one place for too long. It's almost like their adrenaline is too high, their immune system is too busy. They just don't seem to be able to make that transition. So they're active. If they plan ahead of time, they can move a little better. So that type of dizziness is pretty common. It's somewhat in the range of the autonomic nervous system. So I think a lot of these problems will start coming together soon. Well, I think that we're reaching a point where I'm going to address 2 or 3 more questions. And then there might be some other questions that will come in afterwards that I'll be putting out. But this is my 11-year-old daughter has tested positive for 41 and 23, yet Western blot says negative Lyme. She has struggled with neurologic tics such as eye blinking, bladder spasms, heart racing at rest, and palpitations. It's very common to have bands. Now, this writer didn't say whether they were the IgM type or the IgG type. IgM is the very first responders. Later on, the body goes on and has an IgG type. The frustration with Lyme is that you don't always get an IgG answer. And so doctors are saying, if you don't get an IgG band or series of bands, then how can you prove Lyme? So you're sort of left with clinical judgment. Clinical judgment means you not only have to look at Lyme, but you have to make sure there's nothing else going on, that no other specialist can find a reasonable answer. Now, in this case, the reason I said the Western blot was negative, it didn't have the right numbers of bands. 1994, they came up with this idea that you have to have 5 IgG bands, or 5 out of 10, or 2 out of 3 IgM bands. Now, what's interesting, when this 11-year-old daughter of yours had neurologic tics, such as eye blinking, is that there's a group of Lyme patients who seem to fall into something called PANDAS. PANDAS is pediatric acute neuropsychiatric disorder associated with strep. But a lot of Lyme patients will end up in the same pattern. The definition that they arrived at was that they should have a tic, not with a K, TICS, which is sort of a nervous physical movement, Tourette's, which is a verbal movement, OCD. But so many of the people with PANDAS had other problems besides strep that they call it PANS, pediatric acute neurologic syndrome, or neuropsychiatric syndrome. And so the fact that your girl had eye blinking makes you want to look at this type of problem, like PANDAS or PANS type presentation. It also is important to get a neurologist involved to make sure there's nothing else going on. A lot of people have bladder spasms or bladder symptoms that sometimes act a little bit like interstitial cystitis. They act like their bladder's wrong. Racing heart at rest is common in the dysautonomic or autonomic issues, and palpitations. So very common, I'll find that it's not so hard to diagnose Lyme anyway, because if you look at one symptom, there are often 10 or 12 different things going on at the same time that are all pointing toward the same problem. So I find that I have to take more time in an interview. I have to be more methodical in an interview. I have to get both parents involved. If the parents aren't together, get them both in the room at the same time. I have to get the child involved if they're old enough to be able to articulate some of what they're doing. I like to have the child's behavior discussed. I like to look at what other doctors are saying, but I like to at least make sure Lyme disease is at least a consideration. And I think that methodical follow-up is important. A lot of times they'll say, "Oh, go to a psychiatrist," or "It must be mom," or something, that doesn't really help. And it's important to take these symptoms seriously, because some kids do well, and there's always some with complications. Hopefully your daughter will find a way to get better. Will being on antibiotics for an extended time stop Lyme and the symptoms? Well, there's some people just happen to get better for a short period of time and then come back and have symptoms. Some people stay well, but it can get complicated. And so it's if you get better in a reasonable length of time, there's more and more doctors who at least take on the first parts of therapy. But just be aware that you have to stick with the child until they get better. Now, I'd like to do is that, given that this is the first Lyme hangout, I wanted to just spend a few minutes talking about my practice. I've been busy in practice. I've enjoyed my practice for 30 years, but it's also something where I enjoy the fight for Lyme. I get beat up at times. The boards have given me trouble, but for some reason I find that strength I'm there for you. I'm there with you. I'm there every step of the way. I admire all of the leaders that are out there working for Lyme. I'm there with you, and I'm helping wherever I can. The blogs I write, I have nearly 200 blogs that are commonly show up on common illnesses that people are experiencing. At least it gets a dialogue going. This book, which I'll shamelessly point out on here, is that I can call myself an author now. Lyme disease takes on medicine. And the reason I picked that particular title is because if ticks have been around for millions of years, if they think infected ticks have been around since the last ice age, and the first human case was 5,000 some years in by the Iceman and Otzi, is that who are we to think that we're going to get this all figured out in a 40-year time period? I've been in practice for 30 of those 40 years, and so it's humbling to think I got it all figured out or anybody else got it figured out. So to be able to have not just the written word, not just the guidelines that I've been writing for ILADS, but to be able to sit here with you in a live feedback, the only place on the web where you can discuss cases and review cases with an expert. And I think this connection will be something I'll enjoy. I expect that in 2 weeks from now, Tuesday, February 13th, 8 p.m. So February 13th, 8 p.m., I expect to be prepared for the next Lyme Hangout. At that particular time, I'm also going to address children, but I'll be addressing children with babesia. The first case will cover 2 women in our area who happen to have Lyme disease during the 3rd trimester. Their baby did well, but on follow-up, the babies ended up with babesia. So I'd like to explore that topic, that case, and other cases. So I appreciate the opportunity to have spent some time with you on this Lyme Hangout. Good day.